Hello! Before we start, let me introduce myself to you. I have many names, so just pick whichever you like. My generic name is Ipratropium bromide, but I believe most people know me by my brand names, which are Atrovent and Atrovent HFA. Lastly, I have a chemical name, which is 3-hydroxy-2-phenylpropanate. Now let's proceed to my drug classifications. Therapeutically, I am classified as a bronchodilator. Pharmacologically, I am classified as an anticholinergic, and my pregnancy category is category B. It's not known if I am safe to use during pregnancy because I haven't been studied in pregnant women. However, studies in pregnant animals showed no birth defects. If you're planning to become pregnant, or if you're pregnant, talk with your doctor about the possible risks and benefits of using me. What is my mechanism of action? After inhalation, I inhibit vagally-mediated reflexes by antagonizing the action of acetylcholine that is released at neuromuscular junctions in the lungs. I react with muscarinic receptors on bronchial smooth muscle and prevent the increase in intracellular concentration of cyclic guanosine monophosphate or CGMP. Decreased levels of CGMP produce local bronchodilation. After intranasal administration, I inhibit secretions from glands lining the nasal mucosa. Let's move to my pharmacal kinetics. I am minimally absorbed in the systemic circulation, 2% for inhalation solution, 20% for inhalation aerosol, and less than 20% for nasal use. 15% of my dose reaches the lower airways after inhalation. Autoradiography studies in rats have shown that I do not penetrate the blood-brain barrier. Small amounts of me are absorbed and metabolized by the liver. My onset is 1 to 3 minutes after inhalation, and I reach my peak level after 1 to 2 hours of administration. However, after intranasal administration, my onset is 5 minutes and my peak is unknown. My half-life of elimination is about 2 hours after inhalation or intravenous administration. Following intravenous administration, approximately 1/2 of the dose is excreted unchanged in the urine. My indications for inhalation are for maintenance and treatment of bronchospasm that is associated with chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. For intranasal administration, I am indicated to patients with rhinorrhea associated with allergic and non-allergic perennial rhinitis, or the common cold. I am contraindicated in patients with a history of hypersensitivity to ipratropium bromide or other Atrovent HFA inhalation aerosol components. Also, in patients who are hypersensitive to atropine or its derivatives. Moreover, I am not to be used during acute bronchospasms or patients with bladder neck obstruction, prostatic hyperplasia, glaucoma, and urinary retention. Here are my common side effects. In the central nervous system are dizziness, headache, and nervousness. In the EENT are blurred vision, sore throat, nasal epistaxis, and nasal irritation. In the respiratory system are bronchospasm and cough. In the cardiovascular system are hypotension and palpitations. Lastly, in the gastrointestinal system are GI irritation and nausea. Now let's talk about the nursing responsibilities before, during, and after my administration. Before administration, assess for allergy to atropine and belladonna alkaloids. Patients with these allergies may also be sensitive to ipratropium. Assess respiratory status such as rate, breath, degree of dyspnea, and pulse before administration and at peak of medication. This is for inhalation. Assess patient for rhinorrhea. This is for nasal spray. And consult healthcare professional about alternative medication if severe bronchospasm is present. The onset of action is too slow for a patient in distress. Instruct patient in proper use of inhaler, nebulizer, or nasal spray. In using nasal spray, clear nasal passages gently before administration. Do not inhale during administration so medication remains in nasal passages. Lastly, explain need for pulmonary function tests prior to and periodically during therapy to determine effectiveness of medication. During administration, if paradoxical bronchospasm occurs, withhold medication and notify healthcare professional immediately. When I am administered concurrently with other inhalation medications, administer adrenergic bronchodilators first, followed by me or Ipratropium, then corticosteroids. Wait 5 minutes between medications. Solution for nebulization can be diluted with preservative-free 0.9% NaCl. Diluted solution should be used within 24 hours at room temperature or 48 hours if refrigerated. Solution can be mixed with preservative-free albuterol, cromolyn, or metaproterenol if used within 1 hour of mixing. After administration, monitor patient for decreased dyspnea, improved breathing sounds, or decreased rhinorrhea. If symptoms do not improve within 1 to 2 hours, or if condition worsens, contact healthcare professional. Hey guys! So that's all you need to learn and understand about me. Thank you for watching.